Hello everyone. Let's talk about the LHV first year students, Unit 2 Reproductive System. The purpose of making these type of videos is only for educational. Let's talk about our topic, reproductive system. Reproductive system in the females are those which are concerned with copulation or coitus or sexual intercourse, fertilization, the impregnation of the female sex cell, the ovum, by a male sex cell, a spermatozoon, and development of fetus and its exist to the outer world. Classification of female reproductive organ. We classify female reproductive organ into three groups: external genitalia, internal genital organs, and accessory reproductive organs. Let's talk about external genitalia. We can call it vulva. Vulva consists of mons pubis or mons vernius, labia majora or labia minora, clitoris, vestibules, and the perineum. These are the visible on the external examination. Interiorly, on the interior surface of the vulva, there is anterior present mons vernius or mons pubis. Laterally means which away from the midline. Laterally, the labia majora, and posteriorly the perineum is present. Let's talk about mons pubis. Mons pubis or mons vernius is a pad of subcutaneous adipose connective tissue in front of pubis or over the symphysis pubis. This area is usually covered with hair at puberty, or in adult female the mons pubis is covered by hair. Okay, moving forward, let's talk about labia majora. Labia majora, or it is called as the greater lip. The vulva is bound on each side. This all area is called as the vulva. The vulva is surrounded on each side by the elevation of the skin, divide of fat and subcutaneous tissue, which form the labia majora. This is the composition and anatomical feature of labia majora. They are continuous, but medially they form the posterior commissure. In front of the anus. In this picture we can show where is the present of posterior commissure. It form the labia majora, form the posterior commissure in front of the anus. This is the position of posterior commissure. Labia majora are composed of skinous epithelium and it contains sebaceous glands. Sebaceous glands are those glands which secrete oils, sweat glands, and hair follicle. Beneath the skin are dense connective tissue and adipose tissue. The adipose tissue is richly supplied with venous plexus which may produce hematoma. What is hematoma? Hematoma is collection of blood if injured during childbirth. Labia majora are same as scrotum in males. In females, labia majora is present, and in males, scrotum is present. The labia majora are about 7.5 centimeter long. And let's move forward and discuss labia minora. This all is labia minora. These are two smaller fold of skin, divide of fat between the labia majora, containing numerous sebaceous glands. Labia minora we can also call as lesser lip or nymphae. Interiorly, they divide to enclose the clitoris and unite with each other in front and behind the clitoris to form the prepuce and the frenulum. What is prepuce and the frenulum? Prepause, the fold of skin surrounding the clitoris, is called as the prepause, and the frenulum, a small thin fold of tissue that connects and supports two parts of the body. The lower portion of labia minora fuses across the midline to form a skin fold which is called as foresheath. This is labia minora, and at the end of labia minora the present is this is foresheath. It is usually lacerated during the childbirth. Between the foresheath and vaginal orifice is the presence of fossa navicularis. Labia minora do not contain hair follicle. The fold contain connective tissue, numerous sebaceous glands, erectile muscle fibers, and numerous vessels and nerve endings. Let's talk about clitoris. Clitoris, corresponding to penis in male, it is small cylindrical erectile body measuring 2.5 cm situated in the most interior part of vulva. Clitoris is extremely sensitive and highly vascular and play an important role in the organism of sexual intercourse. It is attached to the undersurface of symphysis pubis by the suspensory ligament. It is supported by the sensory ligament. The part of clitoris is consist of a body. This is the clitoris body, glands which contains covered by squamous epithelium and richly supplied with nerves, and two crura.